Gabriel the angel. Where's your way? To the bad boy. So
Doctor? Hello, Doctor. Dr. Ravishankar?
Yes, madam.
ನನ್ನ ವಾಯ್ಸ್
Yes.
ಕೇಳಿಸ್ತಾ ಇದೆ ನಿಮಗೆ?
Madam.
Okay. Doctor, I think we have sufficient people in the meeting, so we'll start the session with your permission, Doctor.
Yes, madam.
Okay. Just a moment, Doctor. Good afternoon, everyone. Very warm welcome to Insight, our monthly continued Ayurvedic education series, thoughtfully created for clinicians and practitioners who believe that learning never truly ends. I'm Dr. Usha, your host for the session. I'm delighted to see so many of you here today. Whether you're joining Insight for the first time or returning for another session, welcome home. Insight was born from a simple belief that best Ayurvedic practitioners are those who never stop questioning, never stop learning, and never stop growing. Today, we come together in that spirit. What you will take away from today's session is not just knowledge, it is a clinical wisdom, practical insights and approaches that have genuinely transformed patient outcomes. You are in exactly the right place. About our brands, AyurCentral. Many of you already are familiar with the AyurCentral. What began as a single clinic in Artinagar, Bangalore, has now grown into India's largest Ayurvedic clinical chain, a network of 72 clinics across Karnataka, powered by 120 plus dedicated doctors. At AyurCentral, our purpose has remained unchanged: to make genuine, trustworthy Ayurveda accessible to every patient through both our physical clinics and our growing digital presence. AyurvedaOne. AyurvedaOne is our sister concern and the manufacturing heart of our ecosystem. Every formulation is doctor designed, research driven, and crafted to the highest quality standards because we believe that what a doctor prescribes must deliver real, measurable results. Our vision is to place AyurvedaOne products in the hands of every quality conscious practitioners across India, bridging classical Ayurvedic wisdom with modern clinical precision. So now we have a few quick announcements. Our YouTube channel link will be shared in the chat, and I request all of the participants to subscribe our channel and to revisit the channel for any of our previous sessions. And we have heard your feedback and we are making it better. To ensure your participation certificate reaches you smoothly and without delay, we are now introducing a simple Google form. The link will be shared in the chat box shortly. Kindly take a moment to fill in your details. It takes less than a minute and it guarantees your certificate lands exactly where it should. Thank you for your patience and we promise no more missing certificates. Also, we would like to have feedback from you about our sessions to do better than what we are doing. Today's session is approximately 1 hour long, followed by question and answer session. Feel free to type your questions in chat anytime. It will be addressed after the session during Q&A session. For any technical difficulties, our support team is available in the chat. Also, we will share our WhatsApp channel link in case anyone is not the part of it. Kindly share the WhatsApp channel for regular updates. Now, it is my privilege to introduce our distinguished speaker for today's session, Dr. Ravishankar Shenoy. Dr. Ravishankar Shenoy is professor and head of the Department of Roga Nidana, Dean UG Studies, Muniyal Institute of Ayurveda Medical Sciences, Manipal, Karnataka. Dr. Ravishankar is a clinical physician with over 2 decades of rich clinical and teaching experience. A gold medalist in Roga Nidana, he secured an All India third rank at the prestigious IPGT and RA Jamnagar, Gujarat Ayurveda University, foremost institution for postgraduate Ayurvedic studies. Since 2001, Dr. Shenoy has been shaping the next generation of Ayurvedic physicians as a faculty at Muniyal Ayurveda College, Manipal, while simultaneously serving patients at both OPD and IPD levels at Muniyal Ayurveda Hospital. What makes Dr. Shenoy truly unique is his integrative approach, seamlessly blending Marma Chikitsa and acupuncture with classical Ayurveda to maximize the treatment outcomes while reducing the financial burden on patients. He holds a certificate, diploma, and master's in acupuncture. His clinical expertise skin diseases, liver cirrhosis, non-healing ulcers, lumbago, sciatica syndrome, spondylitis, frozen shoulder, arthritis, amongst others. He also runs a private Panchkarma center and mini pharmacy. Beyond clinical practice, Dr. Shenoy is a prolific literary contributor, having been part of the Satchitra Charaka Samhita project and heading its part 2, alongside ongoing literary projects at Muniyal Ayurveda College. He has chaired scientific sessions at national and international conferences and delivered guest lectures at numerous institutions across the country. Please join me in giving a warm welcome to Dr. Ravishankar Shenoy. Sir, the session is yours.
Thank you, ma'am. Om Shri Dhanvantare Namaha. I think I'm audible.
Yes, doctor, you are.
Yes, let me share the full screen. Okay, yes. So at the outset, I'd like to convey my regards to Mr. Haram Reddy, founder AyurCentral and AyurvedaOne, and also the CEO, Dr. Manoj Samantrai, for this opportunity. So,
Doctor, there is some,
I have just refined understanding.
Your voice delivery is not seamless, doctor.
Switch over to this Wi-Fi hotspot. Just a minute, madam.
Sure, doctor.
Madam.
Hi, doctor.
Am I audible now?
Yes, doctor. You are perfectly audible now.
Yes. Yes, madam. I'll make it full screen. Okay, so just a little refinement of the topic. So it was initially shared as understanding the disease as an Ayurvedic perspective. So just giving a thoughtful approach, I thought I'll make it more on concentrate on the pathogenesis, which will help the treatment as well. So the topic for today's presentation would be understanding the disease pathogenesis and Ayurvedic perspective. So now let me not deviate from the classical descriptions because the theme is anyway a practical approach. It's a clinical approach to the various fundamental concepts. So as rightly has been described, that the knowledge of the disease and diagnosis of the disease is the first and the foremost step before we start managing the patients. So it's clearly said in the text, Rogamada Upariksheta, and then the Tato Anantaram Aushadam, then you initiate the treatment. So now when we look into the various texts, I'll concentrate more on the Sarva Roga Nidana Adhyaya from Vagbhata Acharya Ashtanga Nidana, first chapter. So very clearly it is described that when the person is suffering from diseases, Rogopata Sharira Jnanopaya. So how to be aware that a person is suffering from the disease? You follow this three-step methodology. So Darshana, Sparshana and Prashna. And this concept is something not a new concept, even in the modern clinical sense, though there may be some variations in terms of which step is to be initiated in the beginning. And especially when it comes to the study of diseases, no doubt we have these Nidana Panchakas highlighted in the text. So Nidana, Pragrupa, Lakshana, Upashaya and Apti or Samprapti. So now as a clinician or as a practitioner, everybody would always look for an appropriate diagnosis, and then comes the choice of medicines. So when we examine the patient, we follow these three steps, maybe with the sound knowledge of the Aptopadesha, because we have already medical people, we already obtained a degree. Then what remains is only Darshana and Sparshana. So studying the disease is the next step because we have already licensed practitioners. So examination of the patient or looking for some signs and symptoms about the disease. Now we have a five-fold methodology involved here. Now if you carefully observe each of these now, as is highlighted here, why only these five? So Nidana, Purva, Rupa, Rupa, again the same reference goes. It very clearly says Cha iti Vijnanam Roganam Panchada Smrtam. And highlighting it here, iti means what? It is Parisamaptau. Etavadeva Roganam Vijnanam. So the commentator very clearly says that these are the methodologies or these are the methods involved in examination of the patient and understanding the disease process. So it's also highlighted Panchadaiva etani tatvato na anye rogava bodha hetavaha santi ityartaha. So again clearly both the Ayurveda Rasayana and also the Hindu Tika also, the Hemadri Tika also highlights the same aspect that these five are essential and they are ultimate in diagnosing the patient. Now this is one Samprapti definition that we find in the text. So the manner yatha dushtena doshena yatha cha anuvisarpata nirvritti ramayasya asau samprapti jati agatihi. So this is also the definition of samprapti what we give. So Nidana, again, when we look into the commentaries, there are two concepts about the Nidana that is highlighted. So if you look into Madhav Nidana Vijayarakshita, there he describes about Sannikrashta, Viprakrashta, so fourfold classification. Now, whether we utilize this in our day-to-day practice in each and every patient is a question mark. I'll come to that shortly. So here, now, what all are the factors that we need to concentrate upon when we speak about the pathogenesis? So here, the manner in which the doshas are getting aggravated or the factors involved that cause the doshic aggravation. So Nidana is what we say. And which doshas get aggravated, to what extent they get aggravated. The Vikalpa Samprapti also has to be understood in terms of which guna of the dosha is getting aggravated. Now, not in all disease conditions we go into the depth of these aspects related with the samprapti. But in certain conditions where the diagnosis becomes tricky, or the choice of treatment modality is not so easy, we will definitely have to go deeper into these concepts related with the samprapti. And one more important aspect is, in most of the disease conditions, the Nidana may remain the same, but the disease outcome may vary, or what disease is going to manifest in individuals can vary. Every time the same person consumes the Nidana, it is not essential that the individual should suffer from the same disease. Or given a moment that 10 individuals consume the same Nidana, not all 10 individuals should be suffering from the same disease. Both these are accepted and practically observed. And now, when the doshas are getting aggravated and moving all over in the body, very clearly here in the commentary it is highlighted, Rupa Hanirva, Rupa Vradhirva, Rupantaram Va iti. Many a times we speak about concepts. That is Prakriti Samasamaveta and Vikriti Vishama Samaveta. Now, of course, we have studied this theoretically, but many a times we have not been able to understand it or apply it logically in patients. So, we generally go with the notion that the aggravated doshas will produce their signs and symptoms, or sometimes there may be a deficiency of these symptoms.
Doctor, you are not audible, doctor. Could you please check? No, doctor. I can see you are trying to talk, but we do not hear you. No, doctor, not yet.
Okay, I think I'm audible now.
Yes, doctor, you are audible now.
Yes, sir.
It got self-muted, I don't know. Okay, anyway. So now let me go back to this now. So when we speak about the samprapti, we have some manifestations that can be at times not easy to understand. So that's why the text usually says, especially when it comes to manifestation of the symptoms, the concept is quite clear. You have three doshas.
Doctor, again you went mute.
Okay. So when we look into the disease and the symptoms, sometimes the doshas based on the gunas, the symptoms may not be matching. Now, or else the karma may not be matching. So in these conditions, we have to concentrate on the mentioned symptoms here, like Rupa Hani, decrease in the symptoms, decrease in the qualities of the doshas or the karma of the doshas, or there can be increase in the qualities or the karma of the doshas, or sometimes there can be a modification. Now, whenever there is this Rupantara or modification, we attribute it to this Vikriti Vishama Samaveta combination. The best example is the Pitta Kaphaja Jwara. Anyway, we'll be not touching that particular concept today. So now let me go with the other aspects. So to understand the disease, we essentially go through these 5 factors. Now, Purva Rupa, okay, it is the premonitory signs and symptoms, as we say. So at times when we examine the patient, we may not be able to clearly make out what is going to manifest in the patient. Say, for example, a patient just comes with a complaint of feeling bloated, and when we go on with the examination, we find that he is complaining of a slight loss of appetite. There is a little of mandagni related symptoms. And so he may also say that he is having some salivation in the mouth. There is some sticky salivation. He is feeling too much of thirsty. So now these symptoms may indicate that he is having an ajirna. Now, next, what we do is, now considering this as a state of ajirna, we may plan a treatment. Either we may go with the Hingvashtaka, or we may go with the Chitrakadivati, which is both Deepana and Pachana. If at all there is an associated Shula with that, then we may also consider administration of Shankavati. Or if at all we feel that the Ama symptoms are more, there is a overall body ache feature of like Angasada, then possibly I may go one step ahead and go with the Sanjeevanivati. Now, what might happen is, if the amount of dosha aggravation is mild, these symptoms may subside. Now, if the symptoms subside, then my diagnosis initially of ajirna, that too maybe of Vishabda ajirna, that is confirmed. Now, suppose on day 2, the patient develops 1 or 2 loose stools. Of course, loose stools is a part and parcel of the ajirna manifestation. But if it aggravates, now Atisara itself, loose watery stool itself becomes a dominating symptom, then in such condition, my diagnosis will shift towards Atisara, that too originating from ajirna. Now I have to treat something more than what I did initially. Suppose instead of the loose stools, the patient has an associated pain, severe pain abdomen. Then again, if at all I had not initially given Shankavati or Sanjeevanivati, then maybe for management of pain, I will have to initiate Shankavati or Sanjeevanivati. So patient again may end up with Chardi. So there may be Chardi. And in such condition, now if at all I consider it as Samata, that is coming out in dosha in Utklesha Avastha, then again I can do an Upekshana initially, or again I can go with the better Deepana Pachana drugs. I can add a part of Kshara also, which is Kafachedi. And then I see how the management goes. Now, suppose the patient has both he has a Chardi as well as Atisara going on simultaneously. There is a Shula. Then I say it is Pravradha Ama Avastha. It has gone into Ama Pradosha. So Visuchika. So accordingly, now at what part of Samprapti I am observing the patient, that decides how I consider the patient, what diagnosis I will make, and what will be the probable medicines that I am going to administer. Now, in all these conditions, what is important is the patient may either come in a state of Purva Rupa, that is the Sthana Samshraya Avastha, or the patient may be coming in a state of Vyakta Avastha, that is when the clear-cut Rupas have manifested. In rare circumstances, patient may also come in Veda Avastha, wherein he may be having a few of Upadravas. So if the patient is having severe vomiting and diarrhea along with indigestion, and is severely dehydrated, then of course, yes, Shosha is also one of the Upadravas described. If at all associated with the Jwara, Shwasa, Kasa, then also I say that it is the Upadrava Avastha of Ajirna. So now the question arises, Purva Rupa, Rupa, these are what we observe in the patient. But the first part of Nidana Panchaka, that is Nidana. How often do we consider Nidana in our clinical practice? And what is the purpose with which we try to elicit the Nidanas in the patient? The second question is it absolutely necessary in all clinical settings? So whether it helps a diagnosis or does it help the treatment? Now, this is one important aspect that has to be considered. So the text always says when you plan the treatment or you consider the sadhya sadhyata vichara of the disease conditions, you always have to consider the Nidana. So Nidana is the foremost when you are planning about the sadhya sadhyata of the disease conditions. So if all Nidanas as told in the text, now when I say all Nidanas told in the text, sometimes we do find descriptions like Ruksha, Shita, Guru, Swadu, all these descriptions in terms of gunas. The option is always open. So we have to decide what food the patient has consumed, in what manner that particular food has been processed. Is it actually a Viruddha Ahara, or is it Guru to the patient? So what attribute of this particular food is acting as a Nidana? It is left entirely for us to decide. Now, is it absolutely necessary? Of course, yes. Because if at all the Nidana is strong, then in such condition, definitely I will have to go with a stronger form of treatment. Because it is very clearly highlighted that the severity or the Tivrata, the Bala of the Vyadi, it definitely depends upon the Bala of Nidana. It also depends upon the Bala of the Pururupa and also the Rupa. How quickly the disease is going to get manifested. If at all it is Ashukari, then also my line of treatment will definitely vary. So, which again clearly says that Nidana is one particular aspect that we should always consider. Then whether it is absolutely necessary, yes. So in conditions, at times, if you have to understand the disease process, we should try to elicit the Nidana. In certain cases, what happens is patients are chronically ill, or patients are recurrently suffering from the same disease. Then in such condition, if we know the Nidana, then it is easy to manage. Say for example, patients who are suffering from symptoms of maybe either Shita Pitta or of Udarda, or they are suffering from some forms of Kushta, or they are suffering from Gulma, Grahani. Now almost all Annava Sroto related Vikaras, or maybe recurrent Kasa Shwasa. Now these conditions also, we need to find the specific Nidana. Otherwise, in the long run, until and unless Nidana is avoided, the disease will perpetuate and it can become a Jirna Vyadi. So it is absolutely necessary, whether initially or in the later stages, we try to elicit the Nidana. So whether it helps a diagnosis, yes, in certain conditions, it may help the diagnosis. Specifically now, if patient has a previous history of allergy, he has a previous history of atopy, so some food that he is intolerant to. So you just have to ask the patient, and patient says, yes, previously whenever I have consumed these substances, I have suffered from the said symptoms. So it possibly gives you a clue to the diagnosis as well. Whether it helps in the treatment, yes, Sankshepatah Kriyayo Nidanasya Parivarjanam. So Sushrutaracharya has described in Uttara Tantra that the Nidana, knowledge of Nidana is definitely needed for managing the cases. So now here is something, a flow chart, what we generally speak about the Samprapti Gatakas. So in the Sarvaroga Nidana of Vagbhata, he has described Pratirogamiti Kruddha Rogadhishtana Gamini Rasayani Prapatyashu Dosha Dehe Vikurvate. So the meaning is clear, again self-explanatory. In every disease condition, the aggravated dosha, the adhishtana, the srotas, all these may vary. It has to be accordingly considered. So the doshas, in most of the conditions, the Nidana, as already I have mentioned, the Nidana sometimes may remain the same. The dosha aggravation may vary, but what is the srotas involved, which dusha is involved, that decides which vyadi is going to manifest. And as per various references, what we see in the text, there is a close association between this Nidana, dosha and the Agni. So certain Nidanas directly, say for example, the person consumes Guru Ahara or Atyanta Kledi Ahara, Atyanta Snigdha Ahara. Now, even before the dosha aggravation can occur, the Agni can directly be involved. And as per the descriptions, either in Trivida Kukshiya Vimana or maybe Vagbhata's description, the involved Agni, say Agni is Vishama, that can produce Vata Prakopa. Now, suppose there is a Vata Prakopa, that Vata Prakopa can also make the Agni Vishama. So there is an interrelation between dosha and Agni as well. And the functions of Agni are definitely essential in maintaining a sputa or a clear srotas, and also regulating the dosha sangata in the srotas. So functions of srotas, that is the sputa bhava of the srotas, is also dependent upon the Agni. Then this Agni, it's of course is responsible for the Dhatu Agni functions also. So that is why Agni plays an important role in the physiological functions or maintenance of physiological functions or a state of normalcy or the Swastha Bhava sushtum nirvikarastvena avatishtate. Of all these aspects of dosha, of srotas, of dushya in the body. So if at all Agni is vitiated or the Nidanas are strong enough, doshas get vitiated, srotas is affected and the dushas are also affected, we have the manifestations of Vyadi. Now, this is something what the text describes about the general diseases. Now, understanding the fundamental concepts of the disease manifestation. Now, one step ahead of this, today we are not able to make a clear-cut diagnosis for many of the disease conditions. So very simple, we can just give examples of certain varieties of Kushta as well. So if you take the example of Eka Kushta or you take the example of Kitiba Kushta, various books correlate this with the psoriasis. So some say it is Eka Kushta, some say it is Kitiba Kushta, but I would prefer to say that these are stage-wise considerations. So when there is an acute stage of flaking or plaking, you may call it as the Eka Kushta, where Matsya Shakalopama stage is there. And if at all it is not the flaking stage, but only a hypertrophied scar-like manifestation, what is the Kina Karavat Sparsha, you can call it as the Kitiba Kushta. Now, whatever you do, the line of treatment almost remains the same, except for extra administration or extra requirement of Snehana therapy whenever it is Vata dominant. Both are Vata Kapha, but more Vata dominant would go into the category of Eka Kushta, slightly less Vata dominant would go into the category of Kitiba Kushta. Now, apart from this, at times, skin dermatological manifestations are most challenging. So now, for such disease conditions, does this clinical orientation for the diagnosis change? So now that is what is clearly highlighted in the text, which clearly says this difficulty in clinical diagnosis is not something that is there only now. It has been manifesting right from the beginning. And this is highlighted in the text repeatedly. For people of Alpa Buddhi, we have some other methodologies involved. So, Nanu Yesham Vikaranam Namagraham Chikitsa Na Ukta, Tesham Nama Kushalo Vaidyo Kim Chikitsena. Now, that's the doubt created. If the name is not known, then what to do? So, he rightly says, the author rightly says, Vikaranama Kushalo Na Jihriyat Kadachana, Na Hi Sarva Vikaranam Namato Asti Dhruvastitihi. So, do not be worried or feel shy if you do not know the disease by name. So here, even in the commentary, it says, Nahi nama dhina sarvatra chikitsa. The treatment for the disease is not entirely based on the nomenclature of the disease. So vata jadi jnanam hi chikitsayam pradhanam karanam. So it is the knowledge of the dosha, etc. Etc. will mean the srotas, etc. will also mean the dushya. Now, can this be taken literally? Literally in the sense as it is for all disease conditions tomorrow, this should not be a lame excuse that you need not make a diagnosis. So today's wherein the insurance companies, the health sector is getting reformed. So every amount, every penny spent on health is being managed or it is being reimbursed by the under the insurance sector. So in such conditions, it is absolutely necessary that we will have to mention a particular nomenclature. We have to give the name of a disease. Those conditions, a near about nomenclature, a near about a diagnosis will have to be given. So what do we do in such conditions? So ashesha sthitihi. So in those conditions, what do you do? Sa eva kupito dosha, the aggravated dosha. Samuthana visheshataha. So based on the etiological factors, the aggravated dosha, it goes and settles in different places. So sthanantarani cha prapya, vikaran kurute bahun. So it manifests various diseases. Now, here, therefore, what he says is tasmat vikara prakriti adhishtanantarani cha buddhva hetu visheshamscha shigram kuryadupakramam. So what you do in such conditions is consider the vikara prakriti. And what is vikara prakriti? The cause of the vikara. Here the cause of vikara as per abhyantara karana is dosha dushascha. Here mainly the doshas. So consider the dosha. Adhishtana antarani, the sthana where the disease is manifesting. It could be the srotas as such, or it could be the koshtanga or some other sthana as well. Shadanga Manga Sharira, any of these can be considered. Then hetu visheshamscha, here is the specific bahya hetus that you have to consider. So the factors ahara, achara, kaladaya that has led to the aggravation of the doshas. And based on this, you have to appropriately plan the treatment. Now, continuing further, we generally say that Vagbhata has given a Dashavida Pariksha. For today's practical aspect, I think that is the most easiest one and easily applicable concept in understanding various diseases, which will definitely help the planning of the treatment. So now, understanding the disease, we are habituated with the various terminologies in the text. We have studied, we have mastered the theoretical concept of diseases. So Aptopadesha Jnana is there. What remains is Pratyaksha and Anumana, that is examination of the patient and just noting down the symptom manifestation. So based on the symptom manifestation, you have to assess what is the dosha aggravated, what is the state of Agni, what will be the srotas involved, and accordingly, you have to consider the various disease conditions. So the text gives us a tabulated form of diseases in terms of srotas manifestations or in terms of dhatu pradoshaja vikara. And for every srotas, whatever the vikara that is going to manifest, one general line of treatment is also given. Now, in those conditions where vikara nama kushalo, this particular reference, it applies, where we are not able to make a clinical diagnosis, clear-cut clinical diagnosis, in such condition, we give importance to the dosha. So even for the dosha, you have upakramas. Dosha upakramaniya chapter is entirely described. Then our treatment will be mainly based either on the treatment, which again is justified. We have something called as the Lakshanika Chikitsa, or again the Pratyanika Chikitsa, Vyadhi Pratyanika Chikitsa is also described. That is what we follow the line of treatment in various disease conditions. Then again, there is something called as a Sandarbhika, situational treatment as well. So every disease or every stage wise for the disease, there is a variation in the treatment that has to be considered. Now here, if we look this particular concept, Dushyam, Desham, Balam, Kalam, Analam, Prakritim, Vayaha, Sattvam, Satmyam, Ahara, Avastha. So Ahara Avastha is considered as one in the translatory works, but again Ayurveda Rasayana commentary, it considers Ahara separate and Avastha separate. So wherein he says that Ahara is related with the patient's bala. So what food the patient has consumed. So something that is linked to Satmya and bala of the individual. And this Avastha is something related with the Roga Avastha. So that is what I was highlighting about the Sandarbhika Chikitsa, or the situational treatment we apply. Now, coming to each one of these particular concepts. So here, even minute aspects of these 10 or 11 factors, 10 plus 1, if we consider Ahara and Avastha separately, they have to be considered so that the treatment, so if at all these are considered, then Sukshma Samikshesham Dosha Aushada Nirupane Yo Vartate Chikitsayam Nasas Kalati Jatuchit. So you will not falter in the treatment. So now 10 or 10 plus 1 factors are here. Now the question comes again, how often do we consider these in the treatment? Are they again the same questions that I raised in the context of Nidana? Are they absolutely necessary? Does it help diagnosis in routine clinical practice, or does it help the treatment? Now, there are a lot of concepts, like say you include the concept of Dushya, you include the concept of the Ahara, or you include the concept of Avastha if at all it is considered separately. Now, a patient coming with a joint pain, with a swelling, and he specifically says that there is a stamba, and maybe the early morning there is a difficulty, the stamba is more. Now all these, if at all with manifesting with the clear symptoms of Agnimandya, we may directly say that it is a Sama Avastha. Now many a times, how many of us agree or we disagree, there is definitely a little consideration of the concept of Sama Niramata, even in a condition of so-called Sandhigata Vata. Now if we straight away correlate these Sandhigata Vatas to osteoarthritis or degenerative joint conditions, then possibly even in such conditions where we say that differentiation, as we have been teaching in the academic career, that Sandhigata Vata and Ama Vata, the major is with the involvement of Ama, Sandhigata Vata is Nirama. It need not be essentially. Ama association can occur in any disease condition. So how firmly the ama is involved at the level of the dhatu, that makes the difference what treatment we are going to administer in patient. So here in every disease condition, such avastha bheda of the diseases has to be done. Now suppose a patient of Janusandhigata Vata, patient is aged about 55 or 60 years, coming to me and I find that there is some Shwayatu, there is some Stamba. I may consider it as a Sama Avastha, and maybe for first 3 days I may go with Upanaha, or I may go with some Ruksha Pindas Veda, things of those, or Dhanyamla Nara. And then after the third day, I may think, including Deepana Pachan Chikitsa also may be given. And then fourth day onwards, I may go with the Abhyanga Sveda. If at all there are no Sama related symptoms, I may straight away go with the treatment of Abhyanga and Sveda itself, or maybe Janubasti. So these Avastha Veda has to be considered in each and every disease condition. Now I mentioned that Dushya we usually consider as one of the aspects related with the Samprapti Ghataka as well. Now, which Srotas is affected? Now, based on that, say for example, Pranama Srotas, then if at all the symptom is related with Pranama Srotas, you know better what are the symptoms you look for. So the first thing is you look whether the prana is adequate to the patient or not. It could be kasa, it could be shwasa, or it could be any other symptom. Then in such conditions, you mainly consider the symptoms of pranama sroto dushti. So atisrashtam, ativibaddam. So based on this, you are able to confirm. And accordingly, you decide whether the patient is critically ill, is moderately ill, or is just mildly ill, and what treatment to be given. So is critically ill, you can again go for treatment under admission. You can, in certain conditions, say for example, conditions like Tamaka Shwasa, you can also go for Sadhyavamana conditions if at all Kapha Utklesha is there. Then apart from this, there are other concepts. Now you have to administer some oral medicines. Now a patient of Tamaka Shwasa, and you know that patient will get benefited, or patient also is allergy prone. Patient says previously he has consumed maybe Agastya Haritaki. Now the question is, can you administer a leha form of medicine? Now here the concept of Panchavida Kashaya Kalpana will also come. So can you administer the leha Kalpana to a patient whose Anala or Agni is poor? So definitely as per the description, Kashaya Pana would be the best form of medicine that we can administer to a patient who has Agni Mandya. So there are some factors to be considered here based on the situational condition, not needed for diagnosis, but it is definitely needed to plan the treatment. The Desha also is a similar case. The best example we give for Desha is sometimes the patients do come with complaints. Say about a month back when patients came down, patient in the sense they came down, software engineers working at Bangalore came down to the area of Udupi, Mangalore where I reside, and they gave complaints of cough that lasted for almost more than 3 weeks. And they said that they had the cough when they were at Bangalore, and after they came here, it has changed. And they brought all the Ayurveda medicines that they had taken over there. So it contained various churnas, of course, some classical, some patent. Now here, when the Desha concept comes, automatically I have to consider this area, the coastal area, as being slightly more Anupa rather than Sadharana as compared with the Bangalore. So possibly the correlation of pollution and other aspects also need to be considered, but the Desha in terms of these doshadikyata, that has to be considered. Then Desha, both Bhumi Desha, Atura Desha, both has to be considered. So patient is slightly of Vata Pitta Prakriti. Then in that condition, I cannot administer Sitopaladi Churna with Madhu. Instead, I can ask him to take it with a little of milk, or I can ask him to take it with plain water. I can ask him even to take it with a little of more Sharkara. If he is Pitta dominant, I can ask him to add a little of ghee also along with the honey and consume. So accordingly, the dosage has to be adjusted. The Anupana also has to be adjusted. Bala of the patient. There are individuals like who cannot tolerate even about the classical dose of all Gugulu Kalpas would be 3 grams per day. So Yoga Raja Gugulu you want to administer, it has to be 500 mg tablet if you have. It is 2 tablet, at least if you are giving in the same form as what we prescribe for modern medication. twice daily or thrice daily dosage, then we have to give it as a divided doses in the stomach. Now, Rogi Bala, Vyadhi Bala also to be considered. So severe, more severe the disease. This is what Sushruta says. Even Charaka also it is Dosha Balad Adhikam or Vyadhi Balad Adhikam Upayuktam Aushadam. So it may produce some untoward symptoms. If the medicinal dose is not appropriate to the strength of the disease, if it is Alpa Bala, then in such condition, Akinchit Karam official. Kala already I described again, Ushna Kala, Shita Kala. So accordingly, we have our own choice of medicines. So usually in clinical practice, what we do is medicines like Amrata, Ballataka and so patients having severe Mata. If the patient is of Pitta Prakriti, as the text says, we have to follow all these aspects also in Grishma Kala or maybe in the initial part of the later part of Varsha and also in the Sharat. We cannot administer Ballataka. So, but if at all it is Shishira or it is Hemanta Rutu, I keep a stock of this Amrita Ballataka and use it extensively in all Ama Pradoshaja Vikaras. So, Dhatugata Ama where I suspect. So, in those conditions also, I administer this, including conditions of Arshas also. Then, coming to Prakriti, now this is a concept that usually we do not regularly include for our diagnostic purpose, but of course, as per the text, Prakriti is one such aspect that has to be considered if we have to advise a suitable diet for the patient. So in order to maintain a proper health, it has to be considered. Whenever we are administering medicines, the text gives clear instructions in various medicine applications that it is contraindicated for such Prakriti. So practically we do observe now people who come with Kushta, we administer very frequently Arogyavardhini, and whenever the patient has more of Vata dominant symptoms or if the patient is more of Vata Prakriti, then we find that this dryness or the itching sensation after that increases with the administration of Arogyavardhini. So in Kapha condition where Kleda Bhava is more or slightly in Pitta condition, we can comfortably go with the administration of Arogyavardhini for a prolonged period. Otherwise, the use of such medicines has to be limited. So Prakriti assessment is important, especially when we are choosing the medicines as well. Vaya, of course, makes a lot of difference. Your dosage, everything will vary according to the Vaya. The diagnostic aspects, so differential diagnosis conditions will also vary based on the Vaya. Sattva and Satmya, they are mainly for assessing the compatibility with all the treatments that you give. So if Sattva is good, you can even plan for treatments of Shodhana, where the patient can tolerate it better. Satmya is good, you can go with whatever the Patya described in the text. Plus the patient with good Satmya is also said to have good Bala. So definitely you can plan the treatment adequately as described in the text. Now Ahara Bala, that is again related with the Ahara and also again slightly related, as I already told, with the either you combine Ahara and Avastha together. So the nature of food consumed. So how, whether it is a balanced form of food that he is consuming, and what is the quantity of food? Is it adequate? Is it Pramitashana? Is it Alpashana? All aspects related with all this Vishamashana, Adhyashana, all these also have to be considered. So many a times patients have a habit of consuming food twice a day. So maybe at when they start from home, now especially the fishermen in our area, they leave the home at 4 o'clock and they tend to come back change of ahara also. And instead of the regular 2 doses of ahara, we will have to ask the patient to take food more frequently also. So now these help in certain conditions in diagnosis. They definitely help us in planning a treatment.